was a fantastic summit with I heard a lot of inspiring talks. And being a physiologist, for me, I felt always quite alone in the topic of global health and global warming. Now I see in this summit there are many people that are starting to work on the topic. This will improve our approach in the future.
What I've realized from the presentation so far is that the problem that we have is global, but the solutions are local. And we need those community voices, youth voices, everyone included to fight for actioning.
It was surprising. I was a bit nervous coming in because obviously it's been hosted by the Physiological Society and Wellcome Trust, but because of the Physiological Society, I wasn't sure if it was just going to be real science, physiology, heat, and human health, but actually it's been phenomenal with the breadth and the range of experts that have joined and come to share their knowledge. You know, unlike previous conferences where it's kind of just this presentation of information, like we're all aware of the information, we have the science, we have the evidence, and now it's like, how do we get to the next phase and how do we bring in different key players from ministries, from science, from NGOs, as it turns out, and really they've put the time aside where we can actually sit down and brainstorm in a really focused way and sort of get that next translational stage in action.
It's been a very interesting couple of days, and it's been really good to see the synergies between the multiple different disciplines, especially amongst those maybe slightly lower down in policy with the research and how we can come together and build a case for action. What also stood out for me is the need for us to always put on an inequalities lens. I learned that inequalities exist not only across gender, but also in high and low middle income countries. And so it's important for us to factor those in as we think about strategies and interventions that can address the growing climate crisis and so that we can improve the lives of vulnerable populations across the globe.